Okay, welcome. Welcome for our UCSF Retiree Association and Berkeley Fall Learning Series. Today we have Dr. Seritan with us. Just a quick note on the program. We will be taking questions at the end of the evening. During the program, we will have a couple of chances for you to chat with Dr. Seritan. So please feel free to use that button. Again, so the chat will be used during the program and Q&A will be taken at the very end. And now I'm going to introduce you to Dorla Cantu, who is our speaker series committee person, and she will introduce Dr. Seritan. Thank you.
Thank you, Louis. My name is Dorla Cantu, and I'm with the UCSF Retirees Association Board. This is the third in a series of programs being presented jointly by the UCSF Retirees Association and the UC Berkeley Retirement Center. So welcome to those of you who are joining us for the first time, and welcome back to those who've attended previous sessions. Today's speaker, Dr. Andreea Seritan, is a professor of clinical psychiatry and interim director for outpatient geriatric psychiatry at UCSF's Langley Porter Hospital and Clinics. Dr. Seritan's clinical work focuses on managing the psychiatric manifestations of neurodegenerative diseases. She's a member of the UCSF Haile Debas Academy of Medical Educators and a distinguished fellow of the American Psychiatric Association and the Association for Academic Psychiatry. Before joining UCSF, Dr. Seritan was at UC Davis School of Medicine, where she also served as Associate Dean for Student Wellness. Welcome, Dr. Seritan.
Thank you so much for having me. Can everyone hear me? Sound okay?
Yes.
Perfect. Thank you. Thank you so much. Thank you for that introduction, Dorla, and thank you, Louis, for inviting me. And all of you whom I cannot see currently, but I see 36 participants here on the screen. It's my pleasure to speak to you some of my experience with resilience during these very difficult times, but also I have to tell you I have a hidden or less hidden agenda, which is to learn from all of you. So I jumped at the opportunity when I was invited and I told Louis, absolutely, I'll do it. What best place to learn than from the retirees from UCSF and UC Berkeley. And congratulations to our colleagues from Berkeley on the newest Nobel Prize. I think you're going to need to increase the number of parking spots there for Nobel Prize winners, as well as to UCSF, actually. So without further ado, I'll tell you a little bit what we're planning to do today. And as Louis mentioned, there are a few opportunities to chat, actually a few opportunities for you to do some work. This is supposed to be an interactive presentation and we'll manage the webinar format as best as we can. No conflicts of interest for me. As I mentioned, lifelong learning is my agenda, and that's why I'm here. I do have current support from the Mount Zion Health Fund, and I'm very grateful to them for supporting my work. I owe a great deal of gratitude to all my patients from whom I'm learning every day, and some of the things that I'll share with you, I've actually learned from my patients. And as I mentioned, I'm here to learn from you. I'm not here to tell you things you don't know. Actually, this is an opportunity to remind you of strategies you already have. So our objectives for today are to define resilience and identify your resilience enhancing strategies. And once again, by identifying, I mean reminding you. I'm sure you have them, and I would love for those of us who are going to be brave enough to use the chat box in a moment to share with everyone else, with the entire group, your strengths and your strategies. I was asked to talk a little bit about social isolation and social distancing during this difficult time. And then we will talk a little bit more about strategies, particularly value-based strategies to stay centered during this time, which some of us, including our new UC president, have called the triple threat time. We have so many challenges coming at us that is even bewildering to try to stay focused. So now comes your first opportunity to do work. And I know you thought you were retired, but you're not. This is the place where you do the first self-reflection exercise. And I failed to mention earlier, if you have a chance to grab pen and paper, or if you're more comfortable typing notes on your phones or laptops or however you're watching us, feel free to do so. And this is for each one of us to first take a moment and reflect and write down your 3 most important values. And someone is typing in the chat box. Thank you so much. I think only the panelists can see this. So I'll share what one of the participants said: honesty, integrity, and commitment. And I'm sure you all have similar values, or maybe other thoughts. So does anyone else want to share? You can use the chat box. Beautiful. Someone says environmental integrity against climate crisis. Thank you, Olga. And then someone else, Rosemary, says kindness, building community, and supporting others. And community and health and service. Wow, you are true UCSF, UC Berkeley retirees. And then we see patience, kindness, and sense of humor. Beautiful, beautiful. Thank you so much. I told you this is exactly why I'm doing these presentations. Okay, so now that we've reflected and identified the 3 most important values, the next thing I would like you to do is to take one more moment and write down 3 of your strengths. You've got more than 3, but let's come up with at least 3. And whenever you're ready, if you feel like you can share. I should say most people are very good at identifying weaknesses, not strengths. So I realize this is hard, but you do have a lot of strength, and there's a purpose for doing this exercise. Very good. And we have a leader here, same person who first typed on the first point: gratitude, compassionate listening, and vision. Dependable, honest, and kind. Beautiful. Anyone else? Any other brave people who want to share? Courage, I would say. Let's see. Okay. Patience, empathy, and good listener. Thank you. Thank you so much. Beautiful. Beautiful. And I'm sure more answers will trickle in. So we talked about values. We talked about strengths. And someone just said, yes, this exercise has made me realize that my values are my strengths. Yes, very good. Thank you. I told you I'm not going to teach you anything new. You're just going to come up with the answers all on your own. So we have the values, we have the strengths. We also have someone beautifully mentioning resilience, empathy, and intelligence for strengths. And then the next thing is to come up with 3 behaviors that show you walk the walk. You practice your values. Someone says listening, service, and generosity. And I think these are values and strengths, and probably the way you show that you walk the walk. Mm-hmm. Volunteer work, community and university, and mentorship. Thank you. which is why we're all here. Maintain political commitments and maintain my garden. Perfect pairing. And then someone else says, appreciate rather than criticize, honor commitments, speak my truth. And more expressed values, volunteering, community services. This is beautiful. Thank you so much. So we're doing this exercise to remind you of all the things you already know, you already do, and you already are. You don't need me to teach you any particular resilience enhancing strategies, but I think we can put our heads together and figure out how this can help us. And then someone else just added volunteering community services, assist neighbors, family, and mentoring youth, which is perfect because we're going to talk a little bit about community and people helping their neighbors as well. So as I was coming up, preparing for this presentation, I came across this concept that may actually be, many of you may be familiar, I wasn't, it was new to me, Ikigai, which means exactly, it's a Japanese word, it means exactly life's worth. And it is defined as one's reason for being. And this is an imperfect diagram, but just talks about what you love, what the world needs, so what you're doing for others, which is what many of you have already outlined in this first exercise we did together, what you're good at, so mastery of your trade, and what you can be paid for or used to when you were more actively engaged with the university. So I find that this is very helpful, and I wanted you to take away this concept and think about it if you're not familiar, and if you haven't perhaps already thought about it and reflected on it, and realize how lucky we are, or how privileged we are to have one's reason, to have a reason for being, to have our meaning, to be clear on that. And the reason we're talking about resilience at this particular time is exactly because we need to be centered, and we need to clarify our values and our strengths and our strategies, even more so in times of crisis. And I don't think I don't think this can be overstated how difficult this year has been, and how many crises have compounded. And when you think you've mastered one, or at least started to adapt to one, there's another one. So the reason for being, our meaning, our life's meaning, is very important. And I would suggest, if you ever doubt or feel that you're wavering, feel that you're not as tethered or as centered as you'd like to be, go back to this exercise and go back to the values exercise and remind yourself of the things that are important to you. On that note, to talk about resilience and review very briefly the great body of literature on resilience. The resilience, as you know, is defined as the ability to recover from illness or adversity and to respond to stress in a healthy, adaptive way, such that personal goals are achieved at minimal psychological and physical cost. Meaning, and the emphasis here is on adaptation. That's resilience. As I mentioned, there's a huge body of work on this, and entire books that have been written on resilience. And needless to say, it's been studied in university professors and health sciences faculty, physicians, nurses, anyone who's in the first line of response in emergency situations, teachers, everyone. So quick question was, is resilience innate or learned? In other words, can you modify that? Yes, you can. There are people who naturally feel more resilient, are more optimistic, but also if you cultivate cognitive flexibility, internal locus of control, meaning many of you may be familiar with this, but for those of us who are not, feeling like we have control over things in our lives, and that control is within us as opposed to outside, external locus of control. Other people are doing things to us and we can't do anything about that. A sense of self and knowing who we are, knowing what our personal life's worth is, Ikigai, if you want. And then viewing obstacles as challenges. And we call this the growth mindset. You're probably familiar with the work of Carol Dweck, who is a Stanford psychologist, who came up with this mindset concept. And very briefly, the experiment they did was with children. They gave children mathematical puzzles, and the children who were told they were highly gifted, intelligent, and were naturally very talented, didn't work as hard on trying to complete the puzzles. And the children who knew that they had to work hard for everything they accomplished actually solved more puzzles than the children who were told that they were talented and intelligent. And this just shows the growth mindset. She discovered that and explained in a very small book on mindsets. If you haven't seen it, it would be absolutely worth reading. She showed that children who knew they had to work hard for their results, they actually were solving more puzzles. They were accomplishing more. So the growth mindset is a basic element of resilience. This chart, which comes from Southwick and Charney, is from a Science article. By the way, I'm happy to share all the references if you ask me afterwards. Shows that while there's a continuum from risk factors that can threaten our resilience on the left side to resilience protective factors on the right side, you can actually modify this continuum by intervening in the middle with therapeutic interventions. And cognitive behavioral therapy is one strategy, and there are many others here, many that you are practicing once again, and some that you can ask for professional help with. But once again, it is modifiable. It's not just an innate capacity. It's something that can be learned, can be developed, and can be practiced, which is why we're talking. Southwick and Charney also talked about a number of factors that, starting early in childhood can contribute to developing a certain mindset and a certain resilience capacity. And of course, that goes throughout life. And I'll let you take a look at the list, but positive emotion, optimism, having sturdy role models growing up, a history of mastering challenges, and once again, that growth mindset, the cognitive flexibility, ability to regulate emotions. Self-efficacy refers to our ability to believe that we can succeed and solve problems and master certain situations, as you know. And then, of course, the social support is important. They talk about discipline focus on skill development or mastery, as I like to call it. And then, of course, the next to last 2 bullet points you've already talked about in your values exercise: altruism, commitment to a valued cause or purpose. And then they also talk about physical health, cardiovascular fitness. And then on this next slide, I highlighted in green, or I colored in green, the ones that I think are very common in older adults. You have a lot of positive emotion and optimism, or at least it has been my experience and why I love being a geriatric psychiatrist working with older adults. You have a deep history of mastering challenges. And if there's anyone who can teach resilience to all of us, that is the older adults. Ability to regulate emotions. Older adults have been through a lot of life crises and have had to regulate emotions and solve different life crises and different challenges that have been thrown your way. I think we can also vote for the disciplined focus on skill development. You're all retirees from UCSF, UC Berkeley. So you must have had some skill development, and you still do. You're here because you still like to learn. And then needless to say, the 2 points I suggested, and then the others also are true for older adults, but they're not particular for older adults. I think they're true for younger and older adults. Is there research on resilience in older adults in particular? Yes, there is. Not much, but there is some. And there are actually several studies that show that older adults, when they are faced with a challenge, a new health crisis or another challenge in late life, they usually revisit previous life crises and apply similar coping mechanisms. Or they change that, they use creative problem-solving strategies. So one of the things that I do working with my patients who are facing a lot of life crises, I usually ask, what has worked in the past? And then we try to understand what has worked in the past. Can we apply that to this current situation? And if we can't, can we come up with a new creative problem-solving strategies? But I always ask what has worked in the past. And once again, if people are depressed or anxious, they need to be reminded that they have mastered previous life crises, because it's not going to be very easy for people to think that they actually even mastered life crisis. If you ask people when they're depressed, they'll say, nothing worked. I can't think of anything. So that's our job, to try to help support our patients through difficult times. There was this one study that showed that older adults were more resilient than younger adults, actually particularly when measured with a resilience scale and on the emotional regulation and problem-solving subscales. The younger adults were a little bit better than the older adults at maintaining social support in this study. And then the newest one that just came out in August this year, they took over 700 functionally intact older adults, so meaning people who are independent, they can do all their activities, and they followed them longitudinally for at least 2.5 years, and they found that with aging, depression actually was reduced. As age increased, depression decreased, and this finding plateaued around age 71. I'll say though, if they followed them a little bit longer, maybe they would have found, that the depression continues to be reduced, but we don't know that because that was the design of the study. And many of you, or some of you, are potentially caregivers for life partners, for family members who have neurological diseases or medical diseases or other conditions that put you in the situation of being a caregiver for a family member. So just a reminder that it is very important to take care of yourselves, especially if you're a caregiver and other people depend on you. So, how we say, put on your oxygen mask first. Very important to keep your own resilience and then help others, because otherwise no one wins. On this note, we're gonna move into the next section of the talk, which is even more work for you. I mean, I think it's been a lot of work already listening to me, but more work coming. There are resilience enhancing strategies at all levels. And I want to emphasize that when I give this talk to physicians and medical students, physicians in training, obviously it's a very important topic for all of us, especially in times of crisis, that we're not just talking about individual strategies. Individuals can't be resilient if the system around them, the health system or the university system, doesn't support them. So of course there's the individual level, the institutional level, and then more the community level. For the purpose of this talk, we're going to focus on the individual strategies, but of course we could reflect on the other levels as well. There are many studies on individual strategies, including studies of physicians and, once again, other people who are in the line of fire, so to speak. who are first responders in crisis situations. And these are strategies culled from interviews with physicians and other people. And they talk about, first of all, in order to be resilient, you need to be self-aware. You need to realize when you're in trouble and when you need help. So self-awareness and self-monitoring, cultivating these very important skills are, number one. And you can do this if you practice mindfulness, meditate. People mention spiritual practice as well. Of course, we talked about physical, cardiovascular fitness, physical health. That's very important. Training in attention control comes up over and over, and you saw this a little bit in the larger slide from the Southwick and Charney paper. And this means being able to selectively attend to positive as well as relevant negative information. We say that, we have a mind that's like Velcro for negative information, for negative stimuli, and Teflon for positive stimuli. You give someone positive feedback, it goes in and out of their ears. But you say one time, you say one negative thing, and they'll remember you 10 years later or upon their retirement. So the task in this training in attention control is to reverse that, to make our minds a little bit more like Velcro for positive information and like Teflon for negative stimuli. And that's hard to do. And that's why, by the way, it's hard for people to find strengths also when we do the exercise. And you can think of all the flaws, but the strengths are harder to come by. Cognitive behavioral therapy, it's actually a particular type of therapy. There are many wonderful, very well-trained, very really wonderful therapists out in the community in San Francisco and Berkeley. We're very lucky to have wonderful therapists around us. And I'm not talking at the university, in the community. And I'm very grateful for that whenever I refer my patients in the community for psychotherapy. Cognitive behavioral therapy is a wonderful evidence-based type of psychotherapy. And there are many others that some of us in the mental health field are trained in. And cognitive reappraisal, again, means the same thing, the ability to reframe adverse events in a more positive light. Enhancing self-efficacy is another task and another strategy we talked about. And on this note, I would like you to take a moment and think of one strategy you are using. Can be more than one, but personal strategy you are using that enhances your resilience. And feel free to share whenever you're ready. Beautiful. So someone says meditation and spiritual practices. Mm-hmm. Every day, can I ask? Count your blessings, says someone else. Deep breaths. Mm-hmm. For those of us who have shared already, I'm curious, is it a regular practice? Do you do it daily? Do you protect the time for it and say you're going to do it at 8 o'clock or whenever you get up? Or how do you make space for it in your day? Exercise daily. Very good. Thank you. At the start of the day, says someone. Yes. And someone else says reminders. Thank you, Louise. Reminders on iWatch. Very good. Very good. So setting the time aside, right? Being explicit, being deliberate about it. Beautiful. And then someone else says focusing on the positive, looking for lessons learned and helping others, and gratitude, which is maybe you're trying to extract that as you're going through your day. And then someone else says, then in the end of the day, give thanks for my great time during the day. Beautiful. Beautiful. And spending time in nature. Absolutely. We missed it so much during the fires and the smoke, right? And every time you see the smoke, you think of what's going on in not so distant parts of California, how people are suffering so much more. Mm-hmm. So you have your strategies. Let's see, does anyone else want to share maybe one more comment? Oh, that is so beautiful. Someone says, I maintain a spreadsheet for contacting friends and relatives so I don't forget. Beautiful. Such a great idea. Thank you so much. I should put it on my slide. So absolutely remember others and remember they are our support. Absolutely beautiful. Thank you so much for your participation. You absolutely mastered this chat box in the webinar format. From now on, Luis is only going to do this. I know. Okay, so thank you for sharing that. I'd like to remind you, for those of us who maybe don't do this on a regular basis, that it is important to put money in the resilience bank whenever you can, not just in crisis. When we're in crisis, when COVID hit, that was not the time for us to scramble to remember what do we as health professionals do to stay resilient. That was a time for reminders to do things to stay resilient so we could best help our patients and our colleagues and our community. But that's not the time to scramble. So I came up with this image, and hopefully this will be the take-home point, the resilience bank. Fill it when you can. And I do want to put a plug for mindfulness. We don't have time to talk about this, and we're in San Francisco and Berkeley, so I know you know a lot about mindfulness. And it's been mentioned by some of the participants, but as you know, mindfulness is the cornerstone of attentional training. It actually is related to better cognitive function, better physical health, better sleep, better emotion regulation, you name it. As you know, John Kabat-Zinn, who brought it here from the Eastern traditional medicine, defines it as awareness that arises through paying attention on purpose in the present moment, non-judgmentally. And this is very important because when we're in crisis, the best we can do is to stay in the moment, and we'll talk about that strategy in a few moments, and not be distracted about the overwhelming reality around us. One of my patients actually shared this billboard. I don't know where it's coming from. It was a photo from social media, I think, but I wanted to share this with you if you haven't seen it. If you're like me and you don't go on social media a lot, this was at the beginning of the pandemic. And I wanted to spend a few moments to talk about the pandemic and how deep the loss is, and how much we all grieve, how much we all lose and have lost, and are afraid of. And I really love this because I'll let you read it, but as you can see, it talks about when you're seeing, empty spaces, this is actually love in action. It shows how much we care for each other, for our grandparents, for our immune compromised brothers and sisters, and for people we will never meet. And I really love the closing words here. It isn't the end of the world. It is the most remarkable act of global solidarity we may ever witness. And if you think about it, I personally have never seen anything like this, and I don't think any of us has. People actually acting with this interest, without self-interest, altruistically supporting others. And how many of my patients have had neighbors who didn't previously talk to them, knocking on their door or calling them and asking, what can I get for you from the store? Especially my patients who have mobility impairments such as Parkinson's disease and other movement disorders. And neighbors save their lives. So what does this say about us? It says a lot. And whenever we're struggling, once again, with uncertainty and anxiety and fear, it's good to remember everyone's Ikigai. I have a lot of advice regarding resilience at this time, but once again, I don't think you need it. But just in case, I wrote it. It's on our webpage, on our Department of Psychiatry webpage that we wrote for coping with coronavirus, and I have the link there. But things you might not remember to do, or maybe you didn't remember to do 6 months ago. Now you do because everyone has pestered you. Try to maintain a daily routine. And for those of us who are still working, albeit retired, if you're working, I actually recommend getting out of bed and working at your desk, not staying in bed. Starting the day, like we said, with either a few stretches or yoga or meditation or spiritual practice, whatever works for you, but being deliberate about that. I have many patients who don't like to eat breakfast, so guess what? I ask them to eat breakfast. It's a very important meal of the day for many reasons, but one of them is taking stock of your day. How am I feeling today? And what am I gonna do today? And like the person who said, I believe Ted Bush was the person who said he maintains the spreadsheet. Who am I gonna call today? You know, amongst my friends and family. Exercise, and I know it's very hard when there isn't any smoke. Remember that outdoors exercise is actually safer than indoor exercise. And if you can't get motivated, I recommend a virtual buddy, really meaning someone you talk to and say, I exercise today. And you can text or call. And then they can do the same for you. It's in a way the same thing as you're going to the gym and you're talking to people and they know you're there, but you have to do this virtually. And then you probably know the study that shows that people who have dogs live longer than people who don't have dogs. I'm not necessarily advocating getting a dog right now, but if you have any pet that needs to be walked, it didn't work for me because we have birds. And you know, if you have you know, pets who need your support in terms of exercising, do that. It's good for both of you. Using technology, as you know, to stay connected, I highly recommend at any given time, but especially in times of anxiety, to stay cognitively active, whatever works for you. And all these are examples from my patients. I started collecting examples from my patients the moment COVID hit and people started talking to me and sharing their anxieties. Puzzles, words with friends. I have one patient who reached the highest level and he can't play that anymore because he's, you know, he had to graduate onto the next word game. Sudoku, people learn new languages. I have a patient, I just saw her yesterday and I told her I will acknowledge her today. She's trying a new recipe every day. Her husband isn't that much in favor, I don't think, but hey, she's going at it. Playing an instrument, you know, we have from Institute here, from University of San Francisco. Creativity is also very important, combining our need for novel solutions and cognitive flexibility. And then, of course, it's important to get good sleep. And as I said, if you wanted to see it in writing, it's there on our webpage. And then you probably know that as people started being stuck in the home, jigsaw puzzle sales soared. For those with a history of anxiety or depression, it becomes a little bit more complicated, right? Under shelter in place, it became a little bit more complicated. I have seen that firsthand as a psychiatrist, and I recommend, you know, first of all, calling your provider, calling your mental health professional or your health professional and asking for help, but also reminding yourself, and you may need to write this down or put iWatch reminders, to do a pleasurable activity, and that is something you enjoy, and then an activity that involves mastery. And by mastery, I mean learning a new skill, and that can really be, learning how to join a webinar or how to host a webinar. And take a moment to celebrate the accomplishment. I call this check the box, which is you actually have to check the box. You should see, I'm ashamed to show you right now, but you should see my to-do list. I actually still write to-do lists on paper and check the box. It's very hard if you don't feel like you've accomplished anything any given day or any given week. So do a pleasurable activity and an activity that involves mastery. And check the box. Okay. Moving on for the next couple of slides, not a lot, but I thought I would share a little bit about social isolation. And remember, I'm not saying we should isolate. On the contrary, I wanted to talk about the risks of social isolation. And there's actually quite a bit of research that has blossomed even more so now during COVID and shelter in place. And I wanted to share some of this with you since I was asked to touch upon this topic. The subjective feeling of being isolated is loneliness. So that's subjective, right? You feel lonely or one feels lonely. But the objective state of having few social relationships or infrequent social contact with others defines social isolation. According to this one study that I listed there, I cited there, about a quarter of community dwelling Americans pre-COVID, this data pre-COVID, community dwelling Americans older than 65 are socially isolated, so meet this criterion, the objective state. And then social isolation, according to multiple studies, has been implicated in increased risk of heart disease, stroke, cognitive decline, what we call major neurocognitive disorder, as well as anxiety, depression, and mortality. So we can't have that. Social isolation and social connections also have different aspects. The structural aspect, meaning do we have those connections? The functional aspect, what do they do for us? What functions they serve for us, whether that we receive support or we give support to others. And then the quality, are they good for us? We may have relationships, but maybe they're contentious or they're not, we're not at our best in that diet, in that relationship. So there can be relationship strain. This study looked at, this is a British study, the English longitudinal study of aging, looked at 6,500 men and women over age 52 that they followed over about 8 years, as you can see, and they looked at all-cause mortality, and they asked them, did they feel lonely? So that once again was subjective, a self-report measure, and they measured a social isolation index as a measure of relationships. And how they measured that, they gave 1 point for being single or unmarried or living alone, 1 point for less than monthly contact. At the time, this is pre-COVID, face-to-face phone or written email with children, other family members or friends, and then 1 point for not participating in organizations, not going to church. The scores were 1 to 5, with the higher indicated greater isolation. And what they found in this study, they found that social isolation was associated with increased risk of mortality. And this association remained significant after adjusting for baseline health and demographic factors. So it wasn't because some people had more heart disease or other medical disease. It was an independent association. Loneliness was also associated with increased risk of mortality, but the association did not remain significant after controlling for these other variables. During shelter in place, I also noticed, and the only reason I'm telling you this is because, once again, some of you may be caregivers, may have family members who are in this situation. And so I want to validate if you have seen any of these. Our older adults with cognitive challenges have had such a hard time. First of all, many live in long-term care facilities and their routine is completely disrupted. They can't see the outside world. They can't have contact with their loved ones. There's no bingo, no community activities, things that used to punctuate their days and their routine disappeared. So I have seen professionally fast decline in those with pre-existing major cognitive impairments. I'm seriously wondering if we could, put measures in place to mitigate some of that. Of course, some people were already in care, others are seeking care right now, and I would highly recommend that. Contacting our clinic if you need help. I've seen more confusion. And the family members report more confusion and sundowning, which is the confusion that happens around sundown, around this time of the day, in people with major neurocognitive impairments. And then also psychotic symptoms such as delusions and hallucinations. And once again, the reason I'm saying this is because if you have seen this, that your family members, your loved ones need help. But on the positive side now, social distancing is not social isolation. I want to be clear. Social distancing, you can do social distance and still be in your bubble and be with your partner or with the people you live with, and that's not social isolation. And there's quite a bit of research that shows that strong relationships between grandparents and their adult grandchildren, for example, reduce depression risk in both groups, both grandparents and the adult grandchildren. Also, this is pre-COVID research. Grandparents who help care for their grandchildren or support others in their social network, whether that's adapted right now through phone or email or other social media, enjoy better health and longevity versus those who do not. And I am waiting to see the results of research done now during COVID pandemic to see if that still stands. But my guess would be it does. People who are connected, and once again, going back to the participant who said, keeping the spreadsheet to make sure you don't forget to call people. And that way you give support and then you also receive support. And I've talked about neighbors helping older adults during the pandemic. And I have some examples actually these are from CNN, of adaptations. That's a band practicing in obviously in outdoors. I have to say I wondered about that because I think blowing into the instrument may have caused some risk to the other people. But I guess they're having the requisite 6 foot, 2 meters in Europe distance. The other one is Central Park, I think, in New York City. A visit at a long-term care facility with someone on Mother's Day. And then this is actually those are homeless tents in San Francisco at the Civic Center. And of course, there's all kinds of different strategies that once again we can talk about, and you are doing already. Using technology, it's not just good for keeping you connected, but it's good for your brain because you're learning that new skill you have learned. I would say you have mastered that by now. People have complained to me, I think this question was posed to me, what to do if the grandchildren are too young and they don't like to be sitting in front of the computer or the phone for a half an hour call. And I suggested focusing on something, on an actual stimulus, a piece of paper, a drawing, a story, something they want to share with their grandparents so they can stay engaged during video calls. I've had patients have birthday parties and weddings and bat mitzvahs on Zoom, and they actually enjoyed the fact that family who's spread all over the world could participate, whereas in other times they wouldn't have been able to. And I guess, making the best of the situation. You do know that small, I emphasize, outdoor gatherings with social distancing and masks are okay. Large gatherings are not. And always, always, always remember your PPE. the masks and the social distancing, and that outdoor exercise is a good idea. And this is for me to remember. Every time I look at it, I'm thinking I've got to find that recipe. So this is one of my patient stories. My patient is in book club, and one of the women in the book club loves baking, and she used to bring a baked product every week when they met. So how they modified that, the adaptation, the COVID adaptation, is she still bakes and has it delivered to each one of the participants, and they still eat their baked goods, and they still do their book club. And I really have got to find that recipe. And these are my photos, of reminders for adaptations that I've been collecting, because I think, this is a historic moment. And I have, Trader Joe's tips, and I guess Whole Foods. And this is my sit-stand desk at home. As you know, we sit way too much. Who knew that my textbooks could be so helpful? They actually are. And also, I guess I read some of them, but this is what they're helpful for. Okay, 2 more things to talk about. What to do when there are multiple concurrent challenges. We have COVID pandemic, we have the shelter in place, we have social unrest. We're trying hard to address structural racism, where the work has just started and we're nowhere near where we should be, but we're at least making efforts. And then we have the challenge of climate crisis and the fires, and then the smoke. And then, of course, with the smoke, you couldn't do all the other things that I told you, your doctors told you you're supposed to do, which is to exercise outdoors. So these are my thoughts. If anyone has other thoughts, please share, because I would love for the group to learn, to learn from each other. Tackle the problem at hand. You can't live in the past. You can't live in the future. We have to stay mindful, live in the moment, stay in the present, and tackle the problem you see today. And that's why it's important to take stock of your day, in the morning, or if you want, plan your next day, in the evening. But I think I speak for all of us that there are days when we wake up and there's yet another challenge. And we woke up, at least I did, on September 9th, and it was night during the day, and it was apocalyptic. So we dealt with that day. Break the problems into smaller chunks. It's called the chunking strategy, and check the box. Remember what I said about check the box. If you've gotten one thing done, or called your friend or a family member, and you managed to do that despite all the challenges, or took the trash out, or baked a wonderful new recipe, check the box. I would also say, because we're here in a lifelong learning experience situation, what am I learning from this? And many times throughout this pandemic, for the last 7 months, I've sat down and tried to write or think about, what am I learning? What am I learning from my patients? What am I learning from this situation? And should this happen again, or something else like this happen again? Although we don't wish for that to happen, how can I use this in the future? And then talk to others, which is why we're meeting and chatting and communicating together. Share with others, because you may have learned something that I haven't, for example, or someone else hasn't. And that's why it's so important. Alyssa Apple, who is our vice chair for adult psychology in the department, and a wonderful, absolutely wonderful person who would be worth inviting as a speaker if you haven't yet, and big proponent of mindfulness, talks about the new normal. And she says 3 things. They're also on our website. Expect the unexpected. we can't expect that things are going to fall into routine anymore, because we're going to be surprised. I'd rather not be surprised. So expect the unexpected. Control what you can control, which is exactly what I was saying about chunking and staying in the present. And then she also says, stay positive. The glass is half full. There are lots of terrible things happening, but there are so many positive things and proof of altruism at every step. And we also put together, thanks to Alyssa, coping resources for wildfires, and that's also on our website. Trying to catch up, I guess, with the stressors as they come has been very interesting, I would say, for those of us in the Department of Psychiatry, and we're trying our best, but I feel like we're always a step behind. I do want to say one more thing about leading under uncertainty. And I think this is very important, even though you don't think you're leaders. So take it as this is about leadership, but take it as coping under uncertainty. Under stress, as we talked about, we usually rely on the same coping skills that have worked for us. But when you expect the unexpected, the same coping skills may not work. We may need to find creative solutions. So Deborah Ancona at the MIT Leadership Center actually talks about this new framework for leadership. And it encompasses these different values, if you want, or valencies: visioning, relating, inventing, and then sense-making. And she calls this adaptive leadership. This is the kind of leadership that we need. And this is how we all probably behave intuitively, but I'm trying to make it a little bit more explicit for you. Sense-making is the one value that I wanted to talk about, which is creating a map. And then you do that by integrating a lot of data, get your information from where you need to get it. But of course, I would say the CDC is a more credible source, for example, than others. UCSF, I think, is a very credible source in terms of health information. I've been so proud of my colleagues. Involving others, try to step out of the box. Do not simply apply your existing frameworks because they don't work, and maybe learn from small experiments. And this is creating the map. So you might not know where you're going, right? The idea is that you create the map as you're going. And I wanted to remind you that in very difficult times as this, you're creating the map as we're going, and your compass will be your values, which is the reason why we started with the values exercise. It's very easy to go back to those things you reflected and you wrote, and remember that you may not know where you're going, but your values will point you in the right direction because you're keeping your values and your Ikigai, and that's the most important thing. And one last thing. I know a lot of us are very anxious about the next 3 weeks. Every single one of my patients is mentioning this. So if we're anxious, remember that there are things we can control and there are things we cannot control. And no matter what the outcome is, our values, our meaning, our Ikigai will guide us. Because after all, a crisis doesn't make the person. It reveals what the person is made of. And with that, just to summarize, unprecedented times and multiple concurrent crises call for quick adaptation. Relying on our usual coping skills may not suffice, but adaptive leadership is needed. Resilience building strategies are important, and remember to put money in the piggy bank of resilience every single day, not just in crisis. And I think we should all learn more about Ikigai if we don't already know. I've ordered my book, but it's arriving tomorrow. On this, I'm gonna just stand up for a moment to turn the lights on, and then I'll take questions because I realize it's dark around me.
Hi, everyone. Now is the time. If you have some questions, you could go down to the Q&A box below, and please feel free to ask Dr. Seritan some questions. Thanks.
And better yet, ask it of all participants, because I'm pretty sure there's collective wisdom in here.
So we have our first question. It says, sometimes I lack motivation to exercise. What can help?
I love that question. I would recommend a virtual body. Is there someone we can think of that you know, would actually need the motivation as well?
Will this presentation be available for playback? We will send out a notice if and when it's available.
Thank you so much. Yes, thank you for that question. I think if the ratio of truths to blunders is okay, we'll probably allow it, but I'll have to see how it came out, if that's okay.
Okay, well, if there are no more questions, I'm going to actually ask Carrie. Oh, let's see.
The slides, yes.
Slides, yes.
Mm-hmm.
So I'm going to ask Carrie to come up, and then also Dorla, if you could unmute if you want to just say a few words. Oops. There we go.
Well, I just wanted to say thank you, Dr. Seritan. Such useful information and a reminder that we have our strengths. I think it's easy to be kind to others, sometimes more so than to yourself. So I really appreciated what you shared. A lot of kindness goes a long way. At least that was one of the things I was reflecting on. Thank you. I really appreciate this partnership between Cal and UCSF, because we're able to bring these medical topics to a broader audience. So thank you so much. Looks like we're getting a few more questions too.
Okay, do you want to go ahead with more questions, Louis?
Sure. Let's see. Maybe I'm not seeing the new ones.
I think someone commented on groups at Langley Porter for older adults, and yes, we have some groups, and I'm glad to the participant who mentioned that. I'm glad that that's been beneficial. Thank you. And then I think there's some questions in the chat box. Mm-hmm. Thank you. Yes, for sure we can make the slides available. I'll definitely, Luis, what's the best way?
So the slides and the video will be posted through UC Berkeley, and I will also have it posted on our website. I could send an email to all attendees when those are available.
Mm-hmm.
Link.
I can send the slides tonight.
Okay, great.
Mm-hmm. Any other questions, or everyone wants to go exercise now?
Many thanks to Dr. Seritan, a really important discussion. I really appreciate you from Theodore Bush. This was wonderful from Katie Maloney. Thank you.
Thank you so much. Thank you all. Thank you for having me and for the opportunity to learn from you. I wish we had more opportunity to interact, but I really appreciate everyone's everyone's comments and participation and reminders of your strengths and values. Very important.
Yes, well, thank you, Dr. Seritan. Again, once we have the finalized version of the program and the slides, I'll go ahead and post those, and Berkeley will also have those posted to their site. But we thank everybody for joining us this evening, and we hope to see everyone soon.
Thank you. Have a good evening.
Bye-bye.
Thank you. Bye. Bye-bye.